Hi, I'm Joe Butt and you're watching Joe Butt TV. I'm today here with one of my very good friends, Colin Campbell, a colleague that I've worked with very closely over the years. I even taught with him at one of the implant programs that was run by ITI, for which both of us are fellows. Colin is a specialist in oral surgery and runs a very successful implant practice in Nottingham. We share some business ideas and we share some clinical ideas, but today he's visiting me to have a chat about implant training. So Colin has set up a Campbell Academy for training for implant dentistry. So I'm absolutely delighted, Colin, that you're here with me.
Hi Joe.
Thank you very much for coming. Colin, question is fairly simple. What do you think are the requirements for a candidate to gain a good sound foundation platform training wise for him to then go out there and practice some fundamental implant dentistry?
I think that's probably now much more well established than it has been in years gone by. I think the days of the sort of much mythical days of the weekend warrior who did a course for 2 days and then started doing implant dentistry is over. And certainly I think, and we have a philosophy in the Campbell Academy that we think dentists should be training in a systematic way with several components to get them to a level where they can comfortably place in the region of 50 implants per year.
Okay.
And I think if we have guys that are not regularly doing that, I think that it's very difficult to maintain that in your practice because of the costs of indemnity, the costs of re-education, the cost of the systems that are required. And so the people that are placing 15 implants a year, which actually is a lot of guys in implant dentistry, really need to re-evaluate their position. So we designed an educational setup and a concept to allow us to take people on that journey towards that.
Yeah.
And the first thing that we recommend for people really is our year program, which is a program to teach the fundamentals of straightforward implant dentistry.
Yeah.
And that's a sort of blended program which has online discussion groups, it has contact days, didactic contact days.
Which is amazing how much people can learn from each other even.
Yeah, and on the contact days we do formal lectures, we do discussion, we do practicals, and we have various aspects that are important, including the clinical aspects. We have some marketing aspects, we have compliance aspects, and then in between the contact days they can discuss online. And they become quite friendly and able to share cases and experiences. And in fact, we now have an alumni discussion group, and the guys that have been on previous courses all get together on there. It's really quite an active group. But then also within the course, they need clinical exposure.
Correct.
Right, and so we encourage people to source patients in their own practice to learn how to speak to them and discuss implant dentistry with them, and then they bring patients to our clinic, and their first implant placements are done in a mentored environment and with us in the clinic. So the cases are planned jointly.
And mentoring is so big with the GDC now anyway, so you're following the same guidelines that have been set out.
And during that process, if they don't have a formal mentor, then we'll introduce them to a mentor through our mentoring program. So we have a network of national mentors. So we can find a mentor familiar with their system in any part of the UK, and start them on the process of actually integrating what they're learning into their own practice. And then following on through the course into the restorative aspects, then they'll bring the same patients back and restore them following the didactic teaching there. And there's 15 contact days on that year course. Moving on from that, we also have a program of courses that take them into the more detailed aspects, more advanced aesthetic placements and CBCT and sinus grafting. And we would think people are committing to sort of a 5-year learning program to get to a level of competency to get to 50 implants per year. Some of the really hot guys can do it a bit quicker. For some people it's a bit of a longer journey, but it's of that kind of order. So it's a reasonable level of investment both in time and finance and emotion and energy to get to that level. And I think that's just a reality now. And if you're not in for that, it's probably best if you look to go some other route in dentistry. You don't have to be involved in implant dentistry. You can always ask for assistance from someone else.
That's a good plan.